the tightness of your pecs is going to cause low back pain. Hey, it is Marian, and we are doing our Monday moves this week for the last week in our Ditch the Low Back Pain After Breast Cancer series. So this one is moving into the target area. This is moving into the shoulders and the pecs. It's a problem after breast cancer surgery, and you are thinking, how is this affecting my back? It's because of the two other areas we worked on. First of all, those neutral postures, those muscle imbalances, and this comes right into play to say that the position of your shoulders and the tightness of your pecs is going to cause low back pain. So I want to show you today a simple stretch. You know I like things that are simple. The ideas behind are complex. How the body works is complex. But I want to give you simple strategies and simple solutions. And what we're learning today, we are learning that even the posture in the shoulders and the tight pecs are going to have interplay on the back pain, on those aches and those pains, and the movement strategies that you are trying to adopt to get things done functionally, but at the expense of other parts of your body. So I want you to try this exercise with me. I want you to try this stretch. I want to see if you can adopt the other two areas we talked about in our 3 ways to ditch back pain, which are neutral postures and muscle balance. So come with me, let's try this out. So what I want to look at with this stretch today is strictly body position and getting some work through the pecs. And I don't mean work as in workout, I mean work as in stretch. We want to make sure that they are in a position that is not going to keep those shoulders rolled forward, because you probably have adopted that position of keeping those shoulders in a slightly internal rotated position. So we're going to this easy stretch, but we're going to do it well, because I'm all about moving well. So that's what we're going to do. So hands, all we're going to do is clasp them behind your tush. I'll demonstrate from the side. Hands behind. What I want you to do now is make sure that you are in a neutral posture. So if my hand's behind here, I want my ear over shoulder, and I want my shoulder over my hips. So I want to make sure you've integrated our neutral posture strategy. The next thing I want you to do is integrate the muscle balance strategy. I don't want those imbalances. So you may come to this position, and then you may engage those hip flexors, have just that neutral posture. But if you're leaning, then we know that you've got some imbalances that aren't allowing you into those positions. So hands behind, clasp the hands. Now, if this is easy for you, then let's take it one step forward. Let's give you a little bonus here, okay? I want you to clasp the hands behind in this position, nice and neutral. And then lift. Now, if you noticed, and I hope, because I can't see from that position, that I stayed neutral, that I didn't have a position where my head came forward and I lost that strategy in trying to stretch. That's a no-no. That I didn't lean forward, I didn't arch my back improperly, that I kept the nice curve here. So this is what I want to make sure, that I'm keeping this curve here, hands behind, neutral posture, and then the stretch. If you've got any questions, let me know. Our final workshop is this Friday, February 21st. I want you to come to the workshop. It is free. It is specifically oriented for breast cancer patients, because we're talking about integrating strategies to help you post-surgery, post-treatment, and getting you back to the goals that you want in your life, and getting you on a day-to-day basis to feel less pain, more energy. I want that balance in your life, balance in your muscles, feeling awesome. So what I really want you to do is go to marianbarnick.com/back and grab your spot for our last workshop in this series. It is free. It is for breast cancer patients. We're talking the strategies that you need to ditch that pain, and it's going to make you feel better. You are getting the education that you need so you can stay focused on your goals and implement a strategy that's going to take you to exactly where you want to be. So I hope to see you Friday. Have an awesome day.